Hello, Placentia community. This is Eric Holmgren, your ambassador at large, and today I'm with Ashika Sharma of Ashika MD.
Yes.
Did I get that correct?
Very, very close, yes.
Okay. So please tell me how it's pronounced.
It's Ashika. My first name is Ashika, so my practice name is Ashika MD.
Ashika.
It's a unique name, and being that my last name Sharma is quite common in the medical community, I thought using my first name would be a nice, easy, unique way to find me.
Okay. So
yeah.
it's Ashika.
Ashika, perfect.
Emphasis on the Ash part.
Yes,
Okay.
You got it.
Okay.
Yeah.
Sorry. So
No.
Tell me a little bit about yourself. How long have you been a doctor for?
Yeah, so I have been a practicing physician for 13 years. So practicing general pediatrics, and then a couple years ago I got the crazy idea to go back into fellowship, do another year of training, and actually do a sports medicine fellowship.
Oh, very good.
So I've been doing sports medicine in addition for the past 4 years.
Okay.
Yeah.
So with your new practice, you're doing both pediatrics and sports medicine.
Yes.
Is that correct?
Yes.
Okay.
Yes.
And is sports medicine then just for kids, or is it sports medicine for anybody?
You know, I really do sports medicine for everybody. My training, my fellowship, my prior job, I've actually treated from 0 to 90 years old.
Okay.
But for right now, I think I'm focusing more on the pediatric patient so that I can kind of give that full comprehensive kind of care to my pediatric patients. But I will possibly eventually open it up to all ages for the sports medicine side of my business.
Okay. All right.
Yeah.
So for me, I have to wait.
Yeah,
for
you
a
may
while.
have to wait a little
Okay.
while. Yes.
Right. I act immature, but I'm not that. Okay.
Yes.
With your business, tell me a
Yes.
little bit about how your practice is set up. I understand it's a little different than traditional.
Yeah. So my practice is actually what's called a DPC medical practice, so direct primary care. And so what that means is we do not bill insurance as the physician. So what that does is, you know, because we are just kind of directly billing the patient a low monthly membership fee that kind of takes care of comprehensive care for your child, there is no hassle of insurance billing, co-pays, after visit bills. And so for one low monthly membership, typically a couple dollars a day, you're kind of getting everything you need from your pediatrician. And so the reason I kind of started this type of practice is because after kind of practicing in the traditional pediatric practice for 13 years, I saw the frustration of parents, you know, not able to get in with their pediatrician, having rushed visits when they come in with multiple complaints, multiple things they want to talk about. They're given 10 minutes. And the pediatrician, myself, we don't want to rush parents, but we want to be able to take care of everything that they need, but we're given such a small window because unfortunately in the traditional practice, time is money. And so you got to kind of get through patients 10, 15, 20 minutes because you need a certain volume of patients to survive in a traditional practice. And so I found that frustrating. I found my patients were frustrated. They wanted to talk about X, Y, and Z at their well check, but insurance companies doesn't pay for X, Y, and Z. They pay for the well check. And so patients were having to be told, you know what, you're gonna have to come back for that concern, or you're gonna have to make another visit. And so parents are having to take time off from work, make multiple visits, bring in multiple children to be able to just ask a quick question or, hey, can you check my child's ankle injury? You know, so something as simple as that. So I found that this was just such a, you know, inconvenient, frustrating, time-consuming, expensive way of kind of seeing your pediatrician. And so this DPC model has actually been kind of taking off across the country. It is relatively new in Orange County. I'm the only pediatrician who's actually doing DPC here in North Orange County. There's a few in LA and a few in the Bay Area, but this is really a new concept in this area. And so the biggest thing is kind of educating the population on like how this is a quality, accessible, kind of ideal way of seeing your pediatrician for minimal cost per month.
So you can basically see anybody because
Yeah.
you don't take insurance,
Exactly.
and so therefore it's not like if I don't have Blue Cross, so I can't see you or
Exactly.
whatever else. It's a
Yes.
case. Nope, I can see
Yeah.
anybody, and people are basically just paying you out of pocket either
Yes.
this monthly fee
Yes.
for Well, I mean, heck, everyone's got a gym membership. You've got your Amazon, Netflix, whatever
Yeah.
else. I mean,
Yeah.
you're just, this is the next thing.
Yes.
Type of idea.
Yeah.
So,
And so the unique thing about this practice is my patients, my members have direct access to me. So again, when you call to talk to, see your doctor in the traditional model, you're calling, you're on hold, you're trying to get an appointment. Sometimes it's, I just have a question for the doctor. They may or may not call you back at the end of the day, or maybe their nurse may call you or their medical assistant. Here, my patients are texting me. So it's almost like we're family. They're texting me a picture of their patient. Like, it's, oh, I have to go on vacation tomorrow and Johnny has ear pain. Can you maybe see him this evening? No problem. Because I see less patients than I would in a traditional model, I get to really get to know these families, the patients. I'm able to squeeze them in same day, next day. And so it just makes it so much more convenient for busy working parents, busy parents with multiple children, other commitments. So it just makes it a lot easier and you get that relationship. So we build that relationship. So I had these great relationships with the families and their children. And so it's kind of the way pediatrics used to be practiced and really should be practiced going forward.
Old country doctor with your bag and you show
Yeah, and I actually do house visits for newborns.
Oh my goodness, okay.
So up to 2 months of age, I will see your newborn at home in the comfort of your home and the safety, the germ-free bubble that you've created at home. I can come home and see your baby until they're 2 months old.
Wow, that's very cool.
Yeah.
That's exciting.
Yeah.
So I know that you touched on it briefly. The challenge is like letting people know what this new model is.
Yeah.
What are some different techniques or methods that you're using to try to help explain or reach people and let them know about what you do?
Yeah. So currently on my social media platforms, I have Instagram and in the process of setting up my Facebook business profile, sending out information and letters to old patients to kind of explain to them what this model entails. And then my DPC colleagues across the country are doing an amazing job kind of just getting the word out. And with Instagram, being such a great social media platform, that information kind of gets out to everybody. So I'm slowly working on that. I feel like in the community, I've started to kind of reach out to people. I'm actually the team doctor at Valencia High School for their football team. Right. So I definitely, see the athletes in this area. And so getting people to kind of understand that you don't need a certain type of insurance to see me and to get quality care and the care that you deserve.
I do have a question about with the sports medicine side of things. If you have a teenager, for example, who has a sports injury, do they need to be a member with you to come in and be seen? Or
that's
they could
a great
just
question.
Pay out of pocket for those few visits they might
Exactly. So because the sports medicine injuries happen so infrequently, hopefully, you may not need the membership. Or maybe you have a pediatrician that, you don't need to see them very often, or you're happy with your pediatrician, but you want somebody that is specialized in sports medicine. You just want to come in, Johnny has a concussion or an injury, and you want to see that specialist. Yes, we definitely do one-time visits for things such as concussions, injuries, and those things.
Okay,
yes.
Good to know. Yeah. But I teach fencing and archery.
Oh, perfect, yeah.
We don't get very many injuries.
Exactly,
but
knock
when
on
they
wood.
do, I need to know someone I can send them to.
So the membership, a lot of patients, they find that, I'm already going to see Dr. Sharma for the injuries. Oh, and then they had a cold, and they have this. So sometimes the membership is all-encompassing because the membership does include the sports med as well. Okay. So you kind of get this all-inclusive pediatric care and also the specialty of sports medicine, if you get injured.
Cool. All right.
Yeah.
Well, it was so good to chat with you and find out a little bit more about your practice, and particularly the unique elements of it, which I think sounds like you're really offering a better quality consumer experience than what people would be getting necessarily from their other insurance-driven mechanisms.
Yes.
Am I getting the right idea with that?
Yes, for sure. And, and one thing just to clarify, even though I don't bill insurance, it is still recommended to have some type of medical insurance in the rare instance that you need to go to the ER for a broken bone or an x-ray or the lab, like let's say you have to go to Quest. Then those other third parties will bill your insurance as they normally would. This is strictly for my visits, my care. I don't bill insurance. But I'm happy to provide super bills and medical notes so that, let's say, patients that have FSA money or they want to send that bill to their insurance to try and get reimbursed, they are definitely welcome to do that.
Okay.
Yeah.
All right.
Yeah.
That's good to know.
Yeah.
Well, before we wrap things up, is there anything else you'd like to share with our friends out there in the Placentia community?
Yeah, so I'm so happy to be a part of the city of Placentia and now Placentia Chamber of Commerce. I have been open about 2 months. I'm located right here on Yorba Linda Blvd in Valencia. I am taking new patients. So again, I see everything from 0 to 22 years for pediatric care and sports medicine as well. So if you'd like to find out more about Ashika MD, you can follow me on my website, www.ashikamd.com. And if you have questions, you can email me at info@ashikamd.com.
Perfect.
Perfect.
Well, very good. It was so nice to meet you.
It was very nice meeting you.
Yeah, indeed. We'll
Yeah.
shake hands, be official that way.
Yeah.
All right, everybody. I hope you've enjoyed this. And if you have a child or children and are looking for a pediatrician, come check out Ashika. Did I get it right?
Very close.
Okay. Oh,
No, you did fine. Ashika MD.
Ashika MD.
Yes.
All right, everybody. Until our next episode, be well.